You know?
No, but it looks a lot like it.
I was just asked if the bread was mold. Welcome, everyone. We're going to go ahead and get started in just about a minute. We're letting all of the participants into the room right now. Hi, everyone. We're going to go ahead and get started. Thank you for joining us. This is the fourth or fifth now in our series of discussions focusing on home-based childcare and the idea of building long-term or more infrastructure-based supports that will really support the capacity and quality and ongoing development of family childcare providers. My name is Gina Capito, and I'm pleased to participate in this series with Danielle Fuentes-Johnson from the BUILD Initiative, and we really are encouraged by your continued participation and supporting us in really thinking about what this content means to family childcare and how we function as leaders in the space to raise up the support needs and the right types of structures to really forward family childcare as a core partner in our early care and education series. Today, we're going to focus more on addressing comprehensive services. As we've done across these events, we're really sort of layering concepts and thinking about this idea from that systemic level. And so we're going to dig more deeply on the idea of how we address comprehensive services and supports for providers and the families that they serve. Before we jump into that, I want to do just a couple quick housekeeping items. We are, as we always do, the meeting will be recorded, and we will then share that recording out through BUILD's website, which will include the link to where you can access the recording in the chat box here in a couple minutes. So that'll be available afterwards along with the slide deck. There's also a lot of other family childcare and Family Childcare Network-based resources available on the website. And as we discuss things during our weekly chats, we're adding more resources that reflect the types of questions and discussions that we have during these. So thank you again for that active participation in this series. And one other little housekeeping note around framing, as we know that many of you within states refer to your family childcare home-based providers, family-friended neighbor care, licensed exempt, or licensed family childcare providers. There's lots of different terms and phrases, and sort of depends on which audience you may be speaking to, whether it's a licensing construct or a quality construct, or how the providers refer to themselves and the care that they deliver to young children. Throughout our series, we do use the term family childcare and home-based childcare fairly interchangeably. And by that, we are casting a pretty large net to consider individuals that are providing early care and education services in their home is what we're focused on. We do not try to speak to only licensed or only one type of provider because, again, there's such variance across states in how you define that and what that means for providers within your space. So we just want to acknowledge that we'll be moving in and out of the term home-based childcare and family childcare throughout. Now, not to say that as we've had these discussions with you over the last several weeks, there have been specific areas of question or interest that have come up, like how do you engage kith and kin or family-friended neighbor care providers more in the system, and digging deeper into that concept is something that we actually are going to be doing with you when we later in the summer. And so we definitely are hearing you that there are special audiences within family childcare, and we just want to acknowledge that the phrasing that we're using for family childcare and home-based childcare is interchangeable and means the same thing within this series. So let's start with a quick poll to see who else we have joining us this afternoon or possibly morning, depending on where you are in the country, we want to start by finding out what your role is within the home-based care sector, whether you're a provider, whether you support providers through the variety of different types of support structures that exist in your states and communities, whether you work in the administration of those systems, or you may fall into another category, which maybe a private funder may fall into that category. So go ahead and launch the poll so you can take a quick second and fill this in for us just so we can have a sense as we move into discussing comprehensive services. While you all are doing that, I just want to offer another reminder that one of the themes of this series has been active engagement and participation by all of you. I see that there's already some little bit of chatting in the chat, which is great. We encourage folks to say hello, say kind of where they're from, name and state that you're in the chat, and then also to participate. So you are, through this format, you have the ability to unmute yourself, share out thoughts, discuss, ask questions, do the same things through the chat, and we want to continue that theme and approach that we've used across all of these discussions since the early summer, where we want to hear from you in the chat as well as hear from you by unmuting yourself and sharing your thoughts too. So we'll continue to offer those types of points of connection and discussion throughout, and we encourage you to use those. Looks like we're getting pretty close to almost, actually over 83% of you have already voted. So, and so far, overwhelmingly, we have folks from support organizations supporting providers via coaching, compliance, technical assistance. That's actually 67%. And then the next largest group is system administrators, folks that work in administering supports to family, child care, or home-based care providers. So I'm going to go ahead, and since polling does seem to have slowed down, and end the polling so you can all take a look at it and see the results. So a much smaller number of providers this week than we've had in previous weeks. We usually have a higher number of providers joining us. Just take a look at who's with us. Thank you for that. And if the poll stays up on your screen, you just X out of the corner there. I've closed it out here for you, but if you're still seeing it for whatever reason within your Zoom platform, you just go ahead and hit the X in the corner to move on. So thanks, or welcome everyone. I think that when we begin to unpack and really go deeper into understanding comprehensive services, to have such a large percentage of the participants be from organizations that are supporting providers, I think that's a really great intersection with this content too. And so that takes me to talking a little bit more about what our agenda is for our discussion on this particular webinar. And we really do want to, as we've thought about and continue to unpack the idea of how we provide strong, responsive supports for family child care providers, we really want to think about this idea of what comprehensive services and the role that they play within providing supports and capacity building to home-based child care providers. And so we want to start with some definition of what we mean by comprehensive services. And so we have two speakers that are joining us today who have deep experience and knowledge on this and are going to do some of that a little bit more of that theoretical of what we mean by comprehensive services, but then get into the practical. And that's where we're then also going to allow for some more discussion and dialogue as we explore these concepts. In your experience with the concepts, your experience with what families' needs are and how they're met, and how providers' needs are met in communities as well. And so we're going to really think more about that idea of a support system for home-based child care with some practical examples. And then we will wrap it up for the afternoon. And so then moving on, I wanted to start us out on that first concept of a connection. So as we've done many times, we just want an opportunity to hear from you. And what we wanted to do at this point is we kind of look back on 4 weeks of engagement in this family child care dialogue approach. We wanted to hear a little bit of your thoughts on what stood out to you the most over the course of these sessions. And so what we're thinking about here is just a moment where you can share in the chat. Again, you can unmute yourself and share something out. It's not no kind of answering of questions or trying to resolve an issue. You can raise a challenge if that's what struck you the most over the content, but certainly what we've been doing is that idea of trying to layer different concepts around the supports that we find most critical for family child care, and how do you approach that as a state or a community. And so what we'd like to do is, over the course of those events, what stood out to you from participating in these? Is there anything, and if this is your first one, what struck you about this topic and kind of brought you to the discussion today? So I'm going to stop sharing for a second so that we all have an opportunity to see each other, because it's increases the likelihood that we're going to share if we also can get a better sight line to our peers. If you do want to put it in the chat, we'll also raise it up too. So just give folks a second to unmute if you're so inclined. So one of the things that drew Emily to was hearing the intersection between home visiting and quality enhancement or coaching, but also mental health. And so that's a great intersection with our comprehensive services discussion. Anyone else jumped out at you? Everybody ready for the long weekend? It's only Tuesday afternoon. We can't be ready for it quite yet. Thanks, Christine. Christine Johnson-Staub raised ideas to help state child care programs and administrators, which is definitely one of the goals of the work here, is that idea of raising up those things that will support those roles within our states. All right, well, I'm going to give you a pass on a quieter, kind of lighter connection right now. There's definitely some opportunities with more pointed questions throughout the discussion that we're going to have today with Natalie and Sherita. So there'll definitely be more opportunities for sharing, for you to get yourself warmed up into the sharing. There was one other thing that came in the chat that I do want to raise up, the idea of how isolation impacts family child care, and then in regards to the quality coaching and the supports that they're offered. And I think that's such an intersection too with the idea of self-care and mental health supports, and the idea of comprehensive supports for the families as well as the providers when we think about that concept. Thanks for that. All right, with that, let's jump into talking more about the content. As I mentioned, that we have Natalie Renew and Sherita Williams joining us today. Natalie is the director of the Homegrown Project, which focuses specifically on supports for home-based child care programs, and Natalie will give you a little bit more background on Homegrown. And then but both Sherita and Natalie have deep experience in thinking about the idea of comprehensive supports and how those systemic supports support family child care providers, engage families in their communities, and their services are available in their communities, and the intersection of how you think about then delivering those services through a system to family child care providers. So we're really happy to have the interplay of thinking about some of the theory of it as well as the practical implementation of it. So with that, I'm going to turn it over to Natalie to take us away.
Hi, everyone. Thank you so much, Gina and Danielle, for planning this webinar and including me. As Gina said, Homegrown is a funders collaborative. We work across the country with a goal to improve the quality and access to home-based childcare. And I'm really excited to be talking today with you all about comprehensive services, because I think this is a really critical component of quality, and particularly in the context of home-based childcare, where we know many low-income and at-risk children, infants and toddlers, children with special needs are receiving services. So I think there's a particular need to ensure this integration. And I'm so thrilled to be joined by Sherita Williams today, and I'll let her introduce herself a little bit. But I have had the opportunity to work with Sherita in the past, and she really has experience at a lot of the different levels that we're going to talk about today. So Sherita, I'd love to have you introduce yourself quickly.
Yes, thank you so much, everyone. So again, yes, my name is Sherita Williams. I'm currently in Philadelphia at Children's Hospital, and my work there is more around system integration, which I'll speak to a little bit more deeply later on in the presentation. But again, you know, I've had the pleasure of being invited here to speak today to some of my past experiences working in the Head Start field as a health manager, working with a network that also supported family child care homes. And so I'm excited to indulge on this conversation and relive those experiences that I've had working with Natalie in previous years.
Great. So to get us started, we're just going to talk a little bit around sort of the concept of comprehensive services and sort of some of the key features. And so I think just to sort of frame this, this issue, when we are talking about comprehensive services, we're really thinking about this concept of the whole child and the whole family. So we know that early learning experiences are supporting sort of cognitive, social, and physical development. But we also recognize that children grow and thrive in the context of their families and their communities, and that there are many supports that they need beyond just what they might encounter from sort of an educational perspective. And so when we're thinking about the whole child, really thinking about the multiple domains of support that they may need. Comprehensive services really does focus on this idea of the whole family. So the family caregivers, the parents, the siblings, the needs that they may have, both in terms of educational, health, and mental health supports, but also around social supports, stabilizing housing, accessing employment, sort of what are all the things that thriving families need to be successful. And then I think in the context of home-based care, although this is certainly relevant in center-based care as well, really thinking about the well-being of the provider, the caregiver, and what they need to thrive and be successful. And again, there are many similarities between what providers need and families need and children need in terms of this sort of broad-based supports to be successful and to thrive. And so, Gina, if you don't mind going to the next slide, kind of drilling down a little bit more specifically into some of the areas of service for comprehensive services. This is by no means a comprehensive list, but often when we're talking about comprehensive services, we're talking about health, mental health, various aspects of health, and then disabilities and early intervention supports, social supports, and family and parent engagement. And I think, you know, we're going to talk a little bit more about sort of the intersection of the COVID-19 pandemic, and I think how it's sort of elevating our awareness and sort of recognition of the importance of kind of health interventions and supports. But we all know that for children to be successful, they need to have ongoing health promotion, nutrition, physical activity. In the childcare setting, there are a lot of important sort of prevention activities that need to either be leveraged or sort of engaged in locally, you know, in the home-based setting, things like tracking immunizations, ensuring that you know allergies, addressing environmental aspects in the home like lead exposure or mold or things like that. Mental health is a huge component, you know, both sort of the preventative and proactive social emotional support, but then also ensuring that children who have more acute or disturbances or issues have their needs met, and that the supports are integrated into their early learning experience. Dental health, early intervention and disability support is sort of a huge area here. How do we ensure that childcare settings are inclusive and that those supports can be sort of integrated into the experience that the young child is having in their home-based care setting. And then, you know, these more dual generational supports, employment, housing, financial stability for families, and then also kind of this bridging of the home and the childcare setting, so parent engagement in the learning plan and things like that. So again, this is not an exhaustive list, and it's just sort of a starting place to think about the various supports that children need sort of beyond, you know, the high quality early learning and developmental experiences that they're having in their home-based care setting. So as we think about that, we're gonna sort of ask a question to the group and would love to just kind of get some conversation started. You know, as I said, like we recognize that during COVID-19 certain issues are really heightened or more obvious or clearer to us. So we'd love to hear from you all on the webinar today. What are some of the needs that the parents or the providers you know, are telling you about their parents' needs in terms of support for themselves and their young children during this time? So we'd like to just hear from you about what providers are sharing with you. If you're a provider, what are you seeing and hearing from your parents around their sort of comprehensive service needs at the moment? And we're going to sort of go to video. So we encourage you to come off of mute and share, via your video, but you're also welcome to put your reflections and reactions to this question in the chat box.
So Daniela raised in the chat that providers have been asking how they can improve enrollment or get enrollment after COVID. So.
There's also a desire for health information and reassurance that everything's going to be okay.
Emily raised one part about getting pushback, and I wondered if it's if Emily, if you want to share a little bit more about is the pushback it's coming from the families to providers about staying safe, or are providers feeling they're getting pushback from families about not wanting to come back to care? There's a lot of dimensions that certainly we're hearing across a lot of the fields.
Right. This would be families who very much want to come back, who view their provider as, yes, there's respect, but they also view them as, more of a servant capacity, which we run the risk of in family child care all the time. And they're wanting to come back, but they're wanting to come in the program, and our state has said, families stay outside the door, don't come into the front door at this moment. They're wanting to not wash their hands. If they do, they're wanting to, they're just like, and our state also has had, and as many states has had a polarization between mask wearing, between safe health and safety practices in the general population. And then, so we're seeing that also in families that use family child care. I guess, does that help?
Yeah, no, that does. That really helps, because it's that literal idea also of like what if they're allowed to come into the facility and that. Yeah, no, I think that really helps.
I also see in the chat box that the concerns around mental health, the stress and anxiety, behavioral issues of children, and then several individuals mentioned the being afraid with the extra care and cleaning and costs, and how to operate in a way that keeps the providers financially stable.
Along those lines, the policies for the handbook and all of the elements that these new regulations and how do you put those? You put those into policies, and how enforcing those. What are folks kind of writing up, and what supports for providers to do that?
Hi, I thought I'd come on video instead of chatting in the chat box, because I know how it is. I would just add, I think that I've heard in a few states, family child care providers express that, that guidance has come out that's very kind of center focused or center oriented, hard to interpret if you're a family or home-based child care provider. Sometimes there's more guidance coming for home-based child care providers, but it's done after everybody else's guidance, so they're waiting to see how they're supposed to interpret things, and just that kind of not addressing that it's a different setting.
Christine, that really resonates with a number of individuals in the chat box, between affirming that and nodding their heads vigorously and emphatically.
We need a Zoom emoji for that.
Yeah. Great. So, I mean, it sounds like a lot of the ideas that have been brought up are sort of consistent, I think, both in terms of this sort of what's the ongoing infrastructure for health support in home-based childcare? Who is the person that you look to that is helping providers implement policy ongoing, develop their systems to support ongoing monitoring of policy, to connect and support with additional services like mental health supports. And then I think during this time, COVID-19, where we have, a set of really kind of acute needs, both in terms of new protocols, right? How do we implement new protocols, which may not have in fact been written with an audience of home-based childcare in mind, right? So what does this look like in implementation in the home-based childcare setting? But also with a whole set of really kind of specific health questions, right? Where do we go for testing? What actions do we take if a parent won't comply with wearing a mask or hand washing? So these are, lots of sort of questions that I think are very much within the context of the comprehensive services area. And I think sort of part of what we're really going to explore today is the roles of different system actors, so providers, networks, and support organizations, and then system actors around sort of how we address some of these needs. Because I think, from Christine's statement and some of these questions in the chat, or reflections in the chat, providers, a lot of providers sort of need more resource and need more support to figure some of these things out. One, because they may be really specific health questions that health professionals need to address and need support with, or others because there's, we know that home-based providers work very long hours, with limited resources and limited supports. And so how do we get more supports around meeting some of these really pressing needs now and ongoing? So we're going to kind of keep digging a little bit into some of the concepts, and then we're going to talk more about those roles and some particular activities. I think, when we think about home-based when we think about comprehensive services, Head Start is really the model that we're often looking at, though the comprehensive services of Head Start, I think, really do extend far beyond the families for Head Start, right? All families need many of these supports, but Head Start really has articulated a lot of what comprehensive services can look like and how they can be delivered and things like that. So I wanted to just share a couple of kind of reflections from the Head Start Act, just in terms of the how of comprehensive services. So, from Head Start, we see grantees are providing services directly. So they may employ health professionals in their team to support providers and their kind of educational staff in meeting these needs, or they provide these services via referrals. So if you have, experience in Head Start, you have, engaged in a memoranda of understanding, and you have kind of interagency relationships so that you can facilitate referrals on behalf of the families and parents in your program. A really key tenet of Head Start is this need to center support around the needs assessment. And so really looking at the needs of each child, each family, and then the community broadly to make decisions around where those services going to be sort of provided from, but also what services are needed. And so that needs assessment is a really key component here. Again, this kind of dual generational focus, right? The parent, the family, the child, looking at both of their needs and their needs together. Again, sort of interagency coordination is a really key component, and it's a role that Head Start grantees, need to engage in, but it's something that I think we really envision that networks can kind of take on behalf of the providers that they support, really helping develop these relationships with early intervention, health providers, dental health providers, et cetera. Core to this is sort of having protocols for screening, but also collecting data, both to make decisions about when to refer or, how to talk to parents about referring, but also to track and to monitor progress. So these are just some kind of key reflections from the Head Start Act that I think are really relevant for this conversation. I'd love to just invite Sherita if she, I know that this is a real boil down of the Head Start Act into just a few pieces here around comprehensive services. So if there are things that I'm missing, or if there are pieces on this list to really lift up in the context of supporting home-based care.
No, absolutely. One of the things that really jumped out at me as you were going through the list was talking about the interagency coordination. And so my work with family-based childcare has really come to play from my work with Head Start. And one of the things that we really reached out to as a support was our Health Advisory Committee. And that's an opportunity where we have the ability to engage various systems in our community here in Philadelphia to pull in a dentist, to pull in a health provider, to pull in someone from home visiting, to really come together on a monthly, quarterly basis, really determining how often or what the need is, determined how often we met, but coming together to have these conversations about how to support families and what that highest need is. For example, maybe here in Philadelphia, there's a high prevalence of around lead in homes. Is something that we look at. So we might bring someone in to speak to that. We might bring in our medical professionals to talk about testing and where we need to be looking at children's levels. And that's an opportunity for us to learn as Head Start providers and our staff to be able to then communicate that to families. And when it comes to our home-based care, I was lucky enough to be one of those directly employed assets that our Head Start provided to be able to go out and kind of do train the trainer models with our family care providers around these topics, so that they were included within those conversations. I know unfortunately sometimes home-based care can kind of fall into this forgotten sector of childcare when we're talking to community agencies. And so it was really something that I took pride in lifting to anyone that I spoke with in the community, whether it was a medical doctor or a dentist office, to really just help remind them that there is this whole sector of childcare that is not center-based, that families really rely on. And so, again, speaking to bring together that unit of community resources, that's one of the ways that we've done it here in the Head Start community. And I know that may not be as easy for those of you who are not as a part of a system like Head Start. But again, that's one of the approaches that we took, and it really was successful in including family-based care.
That's great. And I think that you sort of raise up this issue of, Head Start has a really codified approach where the grantee is sort of supporting the providers in their network and is really sort of taking on many of those coordination roles and responsibilities. And so, as we sort of think about this, really have been thinking a lot about the role of networks, very broadly defined, that may in fact be Head Start grantees. They may be CCR&Rs, they may be shared service alliances, they may be other community-based organizations that are convening and supporting home-based providers. So I think when we're using the reference to Head Start in this conversation, I hope that folks on the phone, on the call today can sort of think about that maybe in that broader sense of the network as that convener, that's sort of connecting those provider needs with those system needs, and is sort of supporting that interface, because that is such a critical role. And we know that, that sort of the nature of comprehensive implies that there are lots of components to it, right? And so for any one provider to be interacting with this myriad of service needs for families, which based on needs assessment at any moment could change, is really overwhelming. So this role of the network is so critical as that sort of intermediary for providers and systems. So that's a good segue into our next kind of piece of the conversation, where we're going to really just dig in a little bit to these roles, the role of the provider, the role of the network, broadly defined, right? Grantee, CCR&R, whoever that organization in the community is that's playing that role, and then talking also a little bit about the role of the system. So, when we think about the role of the provider, the sort of most important part about the role of the provider is that they are the individual or individuals that hold that trusted relationship with the family, right? They see that child and family every day. Maybe now in COVID times, they don't see the parent as much, but, they're spending a lot of time with the child and the family. And particularly in home-based care, they may be having many years-long relationships with these children and families. So, the role of the provider to both assess the child and family need, to know that child, to conduct observation, screening, and assessment, but then also to sort of communicate with families and engage them in support is really critical, right? To help sort of break down myths or perceptions or barriers for families and help them engage with some of these critical services. I think that's really the critical piece for providers, really holding that relationship and then holding that very intimate, direct observational knowledge of what's going on with the family, and then helping them in this trusting relationship and engage with some of these services and supports. So we're gonna now just turn back to the group and have you kind of enrich this idea and help us sort of think more about the role of providers in terms of you know, the comprehensive services piece. So we have another discussion question. Again, encourage you to you know, come on video or you know, share in the chat. But you know, and I know we only have a few providers on the call, so we'd love to hear from you in particular, but we'd also love for the support organizations, you know, to help us understand, but as a help us understand how providers in your community are navigating this. But from the provider perspective, we'd love to know who you look to help meet some of these needs when you have either kind of an ongoing need around implementation of policy or creating of systems, or a very acute need, right? Something happens today around a mental health need or a health need. You know, who do you look to in your community to help meet these needs?
We have one response so far, the CCR&R.
Great.
Well,
We'd love to hear from some of the providers on the call, sort of who would get the call if something happens, you know, or if you have an issue, or right now as you're thinking about all that's going on with COVID, you know, what organizations or individuals, you know, I know in talking to a lot of providers, and this just popped up in the chat box, Emily said providers depending on each other. And we've seen that a lot in our discussions with providers, where the peer networks are really strong, and folks look to one another to help that. I see there's some folks discussing the role of a network in their community and how they might be supporting them.
Good afternoon, this is Adrienne. How are you?
Hi, Adrienne, how are you?
I'm good, I'm good. It depends on what the need is, because I can say I have a good support system. So through PHMC, yourself, 1199C, for Philly Pre-K, the meetings with Khadijah. So that's the providers meetings, then QUIP, First Up. So it depends on what the need is, but I have a good backup,
Great. Great. So, so Adrienne is a provider in Philadelphia that both Sherita and I know very well, and she's also an advisor to Homegrown. So I'll maybe unpack a few of those acronyms and names, because Adrienne has access to sort of very community provider-driven groups. So Khadijah is a fellow provider who convenes. It's a self-organizing group of providers through that peer model. But then Adrienne also is a pre-K provider for the city, so has access to intermediaries and city supports, and then also sort of reference some of the QRIS supports that are available, you know, in Philadelphia. So, you know, there's a real abundance of support, you know, for a provider like Adrienne, who is licensed but participating in a lot of the systems that have some of these resources, so various networks.
Another one that I'll bring up just from working with providers, that is one that is a little hard to crack, but that is relying on pediatric primary care, especially during a time like what we're dealing with right now with COVID-19. I know that a lot of providers may be looking to the health network that their children go to for answers around certain health and safety guidance. And, you know, again, that sometimes can be a hard network to crack and to actually be able to network with. But I'll speak a little bit more of that when we get to our systems section on some work that we're currently doing.
Great. And it looks like there's another response in the from Michelle that I think it's New Jersey, but the Family Child Care Providers Association and their network. So that would have both kind of that peer component, but also, you know, maybe some support around systems integration and access to policy supports and things like that. Any other reactions from the group? Other providers that want to share their experience in terms of how they navigate or access additional support around comprehensive services? Great. We won't put anybody on the spot. So that's really helpful in terms of thinking about, you know, providers. Now we're going to turn to think a little bit about kind of this role of the network in terms of supporting providers in accessing comprehensive services. So, you know, when we think about the provider, they're kind of holding that trusted relationship with the family. They're assessing the family's needs. They're supporting the families with access. When we shift to think about the networks, again, broadly defined networks supporting organizations, we see that the role of the network is really to support the provider, right? So the network has the trusted relationship with the provider and is sort of gathering data and assessing need at the provider level. So ideally, networks are really able to assess program-wide needs. They're collecting data from various providers to do this kind of program level needs assessment. And then different networks will operationalize this differently, but ideally they would employ or contract with specialized supports. So a lot of networks that we see around the country hire nurse consultants or mental health consultants and sort of bring some of those specialized staff into their staffing to be able to deploy to the providers they support. Networks often take on the role of triaging and managing referrals. And you know, I will maybe just pause here and have Sherita share a little bit of sort of how some of the tools that networks might use to triage and manage referrals and sort of look at data.
Absolutely. So with family-based care being inclusive of the larger network that I worked with, we had the opportunity to have staff that would be that liaison between our family care providers and some of the larger networks. So for instance, if there was supports needed with early intervention, we could work directly with a family-based provider to be that individual who speaks with the family, again, that trusted relationship that family providers have with families to obtain that consent. And because sometimes the nuances of accessing these systems can be a little difficult, then we work with them for to hand off that documentation or that referral. And we had staff that directly worked with specific point people at agencies such as early intervention here in Philadelphia, and I'm sure everywhere else, to be able to get those services in those families. And, you know, that's just an example of early intervention, but, you know, we did this for all levels of different areas, you know, anything from a referral to a child's primary care physician because of high lead levels that were found by our staff on a physical that a family had no idea. You know, that's a physical that they've had for some time now, but maybe because of their health literacy levels didn't understand what that meant. And it's an opportunity for our staff to step in and provide referrals for that family. Hearing and vision screening, things of that sort. You know, if they're, we screen children in our family-based homes, and if there was an issue or a concern from a parent, we support it with paperwork and engaging them in that referral process to their primary care providers or to specialized providers for extensive follow-up. So those are just a few examples of how we relied on our family-based providers to leverage that personal relationship that they have with the family, and more so that trusted relationship that they have with the family, to actually engage them in that follow-up process that we're looking for data-wise. You know, as we're collecting data, we're all about prevention. So we may see that there are issues, that we have a certain amount of children who, you know, are presenting a specific issue, and we want to see outcomes to that. And we really did rely on that trusted relationship with our providers, and they relied on us to be that liaison to the larger network as well.
Great. Great. So yeah, exactly as Sherita described, this kind of relating to systems, being that intermediary that supports a provider in accessing these larger systems, which, you know, in some cases is having these memoranda of understanding and establishing processes for, you know, doing referrals. But sometimes it's also like just another person who can call for the 5th time that day to try to, you know, help a family gain access, or, you know, to deal with a problem. Also, as Sherita referenced, this idea of kind of progress monitoring. So kind of having staff that can sort of follow these issues from, you know, they're screened, they're assessed, they're identified, treatment is in place, there's teaming, but sort of where do we go from here? And really following the progress of families over time. Providing technical assistance, right? So in the case of early intervention, the child is assessed, they've got additional services, but what does that then mean in the childcare setting? What supports might that caregiver or provider need for inclusion? You know, ongoing technical assistance around implementation of protocols, right? So many health protocols are changing right now. We know that providers need additional support and technical assistance, and that's a really critical role for networks. And then lastly, I think networks really are the place where piloting of innovation can occur. Really thinking about using that aggregated data, thinking about systems opportunities and gaps to really think about new approaches and trying out some new and innovative ways to meet family and child and family needs. So with that in mind, we're going to go to another discussion question. Are we going to another no, we're going to go to a poll. Sorry. Go ahead, Gina.
All right. So we're going to, sorry, I was having a little trouble. I'll let you all read it because I know that sometimes folks are on Zoom and don't necessarily have access to the polling. So before I throw the polling up on the screen, just let folks take a chance to look at the poll content itself, which is to really think about what some of the most pressing comprehensive service needs as you see them. And so this one is certainly speaks to providers yourselves, speak to the most pressing comprehensive service need that you feel, but then for all of you that are working with providers, you would have an opportunity to think about what you are seeing as the most pressing service need. And you can also put it in the chat if you do not have access to the poll based on how you're joining. So. All right, you should see it there. Some consistency so far with some of the other issues that folks have raised. Health information coming up as the top one. I'll just give it another 20 seconds or so as votes are still coming in pretty rapid. All right. Looks like everybody that's going to vote has had a chance to, so I'll go ahead and end it so everyone can see the results as we reflect on them.
Great. We did have one chat from Christine saying it's too hard to just pick one. So appreciate that that's true because there's so much going on right now. And I think it's fair to say that many families and children need more than one. But it looks like, you know, from the responses that health information is really the highest percentage need, followed by access to materials and supplies, so sanitizing, cleaning, PPE that providers need to keep themselves and their families safe and the children that they serve safe. And then third on the list here is mental health supports for children, parents, and providers. And definitely have heard that a lot from providers across the country. And then lastly, social supports. So we know that a lot of families are experiencing, both providers and families are experiencing a lot of financial disruption, unemployment, instability of housing, and even food insecurity. So that, you know, I know it's hard to pick one, but I think these are all really critical areas of need for families. And I think it's helpful in terms of thinking about these different needs to think a little bit about some of the different roles that we've talked about, the providers and the networks, and how to meet these needs, and is a good sort of segue to thinking about the role of the system. So that's sort of the last leg of that stool. We've talked about providers, we've talked about networks, and now we're going to transition to talk just a little bit about sort of the role of systems in meeting the comprehensive service needs of children and families in home-based care. So I'm just gonna sort of lay out a couple of big ideas, and then I'm really gonna let Sherita take over this section, because the work that she's currently doing is really a very ambitious attempt to kind of connect home visiting, child care, and pediatric primary health healthcare. But just in terms of thinking about the role of systems, you know, we sort of talked about providers assessing child and family need, networks assessing provider program-wide need, but systems really have an opportunity to assess community-wide needs, sort of go beyond that level of the network. Systems also have the ability to create the conditions for integration. So, you know, that may be as tactical as things like billing or financial incentives to encourage things like data sharing or universal forms. But those are really issues that the system is best suited to take on, you know, to create those conditions for integration. I think it's also, the system is often best able to build capacity for community-wide service and capacity needs. So, you know, it may be very challenging for individual providers or individual networks, you know, particularly small networks, to address the fact that there are no certified infant toddler mental health consultants in an entire community, right? Or something like that. But those are really issues that the systems can think about taking on, you know, at that systems level and building that kind of capacity. This issue around policy, I think both, as we've heard, that there's kind of this, you know, there's need for clarification and support at every level, but sometimes this kind of consumer confidence, giving parents and families the type of information and policy that they need is best met at the systems level. And then sort of this issue of scaling and financing effective approaches, right? So while networks may be able to innovate and create good ideas and pilot things, we really rely on the systems to scale and finance those approaches. So just a few sort of thoughts on, you know, the ideal role for the systems. And with that, I'm going to turn it over to Sherita, who will share a little bit more about some of her current system building work that they're doing, and reflect on some of these ideas.
Thanks, Natalie. So here in Philadelphia, I actually have a unique opportunity to be a part of a pilot program that really intertwines 3 different systems. And those systems are pediatric primary care, nurse home visiting specifically, and then child care. So just to give you guys a little bit of background about how we're intertwining all 3 of those things. One of the things that we're really interested in is we have a large home visiting network here in Philadelphia, and in particularly we're working with Nurse Family Partnership, which is a national model. So some of you may have that in your states as well. But we have a lot of families that really enjoy and rely on that nurse home visitor coming to them. It's very similar to the way that they may rely on family-based childcare because of that personal touch, that intimate experience that they have, and that trust that they build. But one of the things that we really are interested in modeling through my pilot program, which I apologize, I didn't include the name of it. It is in term CCIS is what we call it, but it's Community Clinical Systems Integration. And it's a model where we are hiring nurse home visitors to actually be a part of the same medical team as children's primary care physicians. And what that allows us, Natalie just spoke to, is a data sharing opportunity where a nurse home visitor would have the ability to meet with the family in the home, discuss what that need may be, document it in the same medical system that that child's pediatrician also documents in. And that creates a triage ability where that pediatrician can see what has been discussed with that family ahead of time to make for a smoother, more efficient visit with that family. Now, I'm sure you're wondering, where does childcare come in? So when it comes to childcare, my role is actually a childcare navigator, which is the unique position that they've added due to the fact that data has shown us that nurse home visitors and also pediatrics has been called upon to talk with families about health and safety aspects of the way that their children are being cared for in homes. We've seen an uptick in a large population families that are utilizing that family and friend care, that neighbor care, and then of course also licensed family child care and unregulated child care. But one of the things that they've seen coming through the hospital again is an uptick in child injury. And one of the things that we're hoping that this role will be able to do kind of as a shared agenda for these three sectors is to be able to have my role or anyone who's in this role educate primary care, also educate the nurse home visitors on what quality childcare environments look like, and which is also going to be an opportunity for families to engage in these discussions and feel confident and able to talk with their family, friends, and neighbors, their home-based providers about things that they have concerns about, whether it's something as simple as an outlet cover or something that might be a little bit deeper, such as the situation with COVID-19 and how do I ensure that my child will be safe, you know, amongst the facility also being your home and you having other family members, you know, within your home as well. And, you know, we've just started this work to be able to really dig deep into what those needs of those families are. But COVID-19 has actually provided us a really unique opportunity. Sorry, I hear an echo there. So with COVID-19, it has created a unique opportunity for us to provide some health and safety TA, which is through the poll that we just did, one of the needs that I'm hearing the community is looking into. And we've actually just released a FAQ, a frequently asked questions document that is provider facing. And that was an engagement that we took part in as we were reached out to from the childcare sector to say, we need your partnership in this. You know, the CDC has released, you know, guidance on how childcare providers can safely remain open and also how they can safely reopen. But because that guidance was so broad, we noticed that a lot of childcare providers were still looking for additional guidance. And one of the things that a health system has is that name backing. And so what we did was we partnered with the childcare sector to say, you know what, we agree with the guidance that is already out, but we're going to put our name on it. We're going to go into a little bit more detail from a medical lens, and we're going to provide this as a resource to providers. We're also going to provide this as a resource to families. So we have a provider-facing one. We also are really close to being able to publish our parent-facing document. But again, when you think about those trusted relationships that families have, they trust information that comes from their healthcare provider. So why not bridge that gap with those two systems so that it can be more of a unified voice with presenting this information to the larger network. And we got really great feedback from that approach that, again, was just a pilot, just a suggestion that came to us. And we had the opportunity and the leverage to access those medical providers. And we put that together, you know, within about 2 weeks or so. And it was so well received that My Health Network is actually thinking about longevity, working with the childcare sector and how we can continue to support post-COVID-19 as well. To the fact that we have even most recently been able to have some of our MDs start working on a return to school toolkit, which I know not everyone, you know, has the ability to have their health system work on something like that. But I think that this is a really unique opportunity that I wanted to bring forward to say that sometimes it just takes someone reaching out to say, you know what, do you guys have the ability to? And you never know, that health network may say, you know what, we absolutely do. This won't take much time for us to, you know, put our name on a document and to agree and back up what is being said. And that's exactly what happened. And it's really bridged a gap that was needed by childcare providers specifically, and then also families as they're, you know, having these anxieties about returning to care and what that looks like. And I think another thing that is really unique to the work that I'm engaging in is that it really is, for the most part, focusing on home-based care, because our initial work was about how to make those home environments safer for those families who choose alternative care, who, you know, aren't interested in the larger center network. And so because of that, we're able to tailor those resources we're putting out in regards to FAQs and toolkits, not only to center-based, but also more specifically to home-based care, because that is an extension of the larger project that we were already focusing on. So I know that was a lot, but I definitely wanted to share, you know, it's something that is robust. It's something that's just started. But even in the very beginning, we've already begun to see results and the benefits of bridging those 3 networks. And because of that, we are able to pitch this to funders to receive additional funding to continue this work. So I will shoot it back to Natalie here, but I think that will lead us right to our next discussion question about how we can, you know, really engage the community to provide some of these additional services.
Great, thank you so much, Sherita. And that is a great segue to our next discussion question. You know, Sherita really lifted up this very innovative model in Philadelphia that's bridging, you know, these 3 sectors at the system level. And we'd love to hear from you all on the call, on the webinar today about best practice in your community that's supporting providers. And it can be, you know, at any one of these areas we've discussed, sort of the provider level, the network level, the system level. But what's going on in your community that's helping providers and families gain access to these comprehensive services? So we'll open it back up. We'll strongly encourage you to come on video and share in person, and also in the chat if you feel more comfortable adding there. Also, if you have questions, you know, for Sherita, feel free to drop those in the chat as well. I'm sure she'd be happy to share additional information around the work that she's doing. We will have contact information and website to follow up if you want to learn more about that as well. So in the chat, Elaine shared that the Georgia Professional Family Child Care Alliance created a crisis management response team to help providers deal with all aspects of the COVID situation. So that sounds amazing and super timely. I don't know, Elaine, if you'd want to share a little bit more with us about what kinds of issues the group is dealing with. That would be really interesting.
Sure. So here in Georgia, and I don't know if I can get my camera to stay on, but we created a crisis management response team. Well, actually, one of the leaders in the Professional Family Child Care Alliance did early on, saw the need for having a rapid response and a trusted group of people that the family child care providers in the state could come to get information. And it's fairly comprehensive. We started off a lot with economic supports, but we also have a committee for healthy provider healthy operations, parent and child information. There's the healthy operations group is working to create some like a co-op for purchasing PPE, discounted rates, and looking at co-op and cleaning services, things like that. They also, the organizer of this particular response team has a seat at the state's child care roundtable, where other advocacy agencies don't seem to be at the table for that. And it's really given a voice for family child care around our state, particularly directly to the state administration, the State Department of Early Care and Education, Care and Learning.
Great, thank you so much, Elaine. That sounds really comprehensive. I don't know how many times we can use that term today, but that just sounds like you're dealing with lots of these pressing issues, which is really wonderful. Anybody else like to share with us a best practice from their community, or activities going on that are helping providers meet some of these health or mental health or social service support needs at this time or over time? We do have a question in the chat just around whether there are specific supports in New York, and you know, we're happy, Daniela, to maybe follow up offline and let you know, but also would say, you know, maybe you can tell us more specifically where in New York you are, and we can try to connect you with an organization or a network in your community. Any other reactions? Anybody else like to share? Okay, great. So we will kind of work to, oh, I see Elizabeth just shared. Yeah. Go ahead, Danielle.
Elizabeth shared that Arkansas is having a weekly Zoom call with providers as a check-in for the needs that they have, the questions that they need answers, resources found. Elizabeth, we'd like to hear more if you're in a place that you are able to share.
Hey y'all, sorry, got choked there. We've been meeting on Mondays since the beginning of this, because just of the fear. I mean, there's just so much fear around small family child cares that many of them were just private pay. They didn't take vouchers. They don't have any state funding or federal funding or anything. And so when Arkansas kind of shut down, I mean, they had 0 children coming. And so, you know, panic as it did across the country set in. So we began meeting with them, and we did this just yesterday, had some mental health things that we discussed a little bit, but our network actually officially rolls out tomorrow. I'm the new network advisor, and I've worked in the early childhood field for about 25 years, but my children were in family child care, but this is a new role for me. And so I've just been asking a lot of questions. And I think on the Zoom call, we just kind of sit back and let them talk. And yesterday, we've had one home that had a child test positive because a parent tested positive and the parents weren't honest with the provider. So there were lots of questions around that. And then another home had a parent test positive. So they get different information from different people. Health department says the parent was not in the home, so they don't have to close, but the other parents are concerned. So there's just all of these different dynamics that are playing into this for these providers. And so what we've just tried to do is be that support for them, and just, if I can find a resource for them immediately, I try to find it and get it to them, along with our Family Child Care Providers Association, our Arkansas Early Childhood Affiliate Association. We're all running the same circles, so we're all there together, and we're able to just say, you do this, and you do this. And that's what we've been doing, but we've still lost, in just Northwest Arkansas, we've had 10 homes close during this time, and 3 of them have already turned in their license. They're not going to reopen, and that's scary to me because these were homes that are in the QRIS system that were doing good things, and fear has just taken over, and so we got to figure out a way to keep them supported and in whatever way that we can. So I will take any of your ideas, thoughts, resources that you would like to share, because like I said, we know we've been working on the network for about a year, and timing is everything, and we believe that it's time for us to jump out there and do everything we can to help these providers stay in business and continue to grow and build. You know, Arkansas is the natural state, and our children are our most precious resource, and so we want to make sure that they are served in every capacity. So I'll take all of your ideas and thoughts that you can give me for meeting these providers' needs. Thank you.
Thank you.
Hi, Natalie. This is Beverly.
Hey, Beverly. Nice to
Hi.
meet you.
Hi. I just want to share a little bit. I know you asked what are we doing in our states to kind of support our family child care providers. Well, anyone in child care. So I just had to say that we have a family child care, New Jersey Family Child Care Association here. And what we have done so far, we've had 2 listening sessions where we just bring providers together and we just talk about our concerns, and we share resources. And I think and the providers enjoy that because they get to voice. They get to talk to someone, their peers, and, you know, someone who's going through the same thing that they are going through. So I just had to say that. And I also want to say that we just recently had the Family Child Care Summit, and that was awesome. We had a couple of panelists within the summit, and we kind of voiced what was going on with us and how we felt about being child care provider, and, you know, just trying to move forward in a positive way. We also we can't complain because we have a lot of support here in New Jersey. I don't know, just to name a few, we have ACNJ, we have our site board, we have, of course, our association, we have CCA&J, I don't want to leave anyone, all our kin. We just have a lot of support. And also for mental health, we have Mount Clair University, who, I mean, they're awesome when it comes to mental health. We even have listening sessions for that, where we come together with a facilitator, and we get to talk about just how we feel during this time and where we're at today and where we just looking forward to being tomorrow, you know, in the future. So I just wanted to share that. Thank you.
Thank you, Beverly. Thanks so much for sharing that.
You're welcome.
I think Beverly's reflections are really nice, kind of connection to something that was raised earlier in the conversation around isolation and this sort of importance of this sort of emotional peer support as kind of a critical component of sharing and accessing resources. So thank you, Beverly. I really appreciate you sharing, you know, some of your experience in New Jersey. As we kind of keep moving here with our presentation, I did want to just raise up another comment from the chat that AUIC is researching shared services. It sounds like that work is still kind of in progress, but you know, kind of again, shared services alliances are one of those sort of broadly defined networks that are really well positioned to support providers in accessing specialized services or purchasing specialized services on behalf of them, but also this kind of intersystems liaising. They're really well positioned for that. So I'm very excited for the providers in New York that they'll have access to that. So we're gonna just sort of talk a little bit about this is kind of, I think, a summary to some degree of the conversation that we've had, sort of really pivoting to think about kind of the COVID specific experience, which has really been throughout our conversation, and just kind of underscoring a few of the comments that have been raised in the conversation today. From my perspective, comprehensive services is sort of an integral part of quality today and every day. But I think, you know, as we've surveyed and talked to providers across the country, and partner organizations like NAFCC and others are doing the same, you know, of our list of 6 or 7 issues that providers raise, most of them relate to a comprehensive services issue. And so just want to kind of call out a few of these really big ideas we've heard from providers across the country as they really struggle, you know, to respond to COVID-19. So, you know, health concerns for themselves as providers, for their families and their homes. It is such a unique service environment because it is the home of the provider and caregiver, but it's also the caregiving space. And so there's providers' own families, but then also really deep concern for the families that they serve. And, you know, really appreciate Elizabeth kind of raising just both the heartbreaking and incredibly complex and difficult decisions that providers have to make as they are now seeing families that they serve and in their community that are testing positive for COVID-19, and all the many ripple effects of that is really, really challenging. This has also been raised, but sort of this access to supplies and both sort of ongoing regular supplies that we need every day to do this work, gloves and cleaning and sanitation supplies, but then also access to PPE. NAFCC recently did a survey of providers, and really large portions of providers across the country continue to have challenges in accessing PPE and sanitation supplies. This issue of information, sort of from the beginning of this call, sort of how do home-based providers get specific, distinct, and timely information that they can take action on? This is such a critical issue, and really, you know, how do we assure that that's available? And then just sort of a myriad of issues that I kind of bucket as reopening. So this is sort of making changes to your ongoing protocol. I saw in the chat a kind of raising this issue of changing the physical space to accommodate social distancing, or moving your, you know, that there may in fact have to be like these very hard costs to renovate space to accommodate reopening under new guidance. Getting information and support and technical assistance and training and funding to put all that together is really complex, and you know, sort of a part of this larger package of comprehensive supports that providers need right now. So we'll move now to you know, another conversation, you know, another topic for the group, and would love to just hear sort of from folks in the group. I know there's a number of systems administrators participating on the call today. So, you know, we wanted to sort of open up for a discussion on, you know, really thoughts on how system leaders across the various sectors can support home-based providers and can support networks in accessing these supports. So we'd love to hear from the system leaders, you know, on the call today, but also anybody else on the call that has a great idea, maybe even a suggestion or a hope for the group. But what are some ways that systems can support providers? We really heard from Sherita of a health system sort of hearing the call from providers to have some specific and tailored information that they were able to take internally and get their experts to respond to. But what are some other ideas or some other thoughts from across the country that we can learn about together with each other today? And again, we'd love you to come on camera and share with us or put something in the chat. right, we're gonna maybe just one more prompt if anybody has, oh, here we go in the chat. Kelly is sharing with us that she sits on the Governor's Advisory Council specifically with a family child care focus to ensure that recommendations are being created with that lens for providers. So it sounds like Kelly is really in that role of trying to ensure that policies and recommendations are specific, timely, and distinct for home-based providers, which is great. Megan shared on the chat just how important it is to ensure that providers are a part of these conversations and sort of, you know, I think that's absolutely true, both from the leadership and decision-making perspective, but also I'll kind of go back to that concept that I think Head Start has really institutionalized, which is this role of needs assessment and collecting data. Other thoughts and reflections on this question? Sounded like somebody was gonna jump in here. Okay. All right, well then I think we'll just move on because we are coming to the end of our time together. I wanted to just share a couple of final thoughts and we'll also, you know, invite Sherita and anybody else on the call to just sort of reflect on some of these sort of final ideas. You know, sort of as we look ahead and sort of what are some of the opportunities or some of the aspects of the sector that are really changing. I'll just sort of highlight a couple of ideas. You know, one, that the pandemic has really underscored how critical health and mental health is to, you know, safe and quality childcare, and just really, I think the call for better integration of health and mental health. You know, the pandemic has really brought that issue to light in new ways. I think we are seeing some incredible innovation that's occurring under just these really difficult circumstances. But, you know, in the home visiting and early intervention side of the house, you know, because of televisits, you know, being online, we've seen new opportunities to engage, you know, home-based childcare providers and other caregivers in teaming and assessment activities, you know, really interesting new ways to increase participation during this time. I think there's some really exciting things going on in terms of who knows about childcare, who cares about childcare, who's at the table to talk about childcare, right? Every day we see an exciting, though often very sad article in the news, but we're hearing from the business community and industry leaders and the system leaders, you know, healthcare leaders and others who are really engaged around the issue. And I think some really important opportunities to leverage and build those relationships. And then lastly, I think, you know, one of the things that is happening right now that is true always, but I think is really obvious right now, is that there are sort of outcomes that systems share that we can collaborate with to meet, right? So we're seeing some, you know, really challenging trends around sort of regular access to healthcare during the pandemic. And I think this is a place where, you know, we know that where if childcare and healthcare systems were collaborating, we're leveraging those trusted relationships, we're supporting one another, you know, we could really see improvements in some of these key outcomes, and that these are sort of bi-directional relationships, right? That there are outcomes for the childcare sector, there are outcomes for the healthcare system, and there's a lot to be gained and learned and shared from one another, and that there might be some really interesting opportunities, like this opportunity in Philadelphia, to sort of conceptualize these as shared outcomes. So those are sort of my final reflections. Sherita, I'd love to invite you to share any of your sort of final thoughts or reflections.
Yeah, absolutely. I think the thing that stuck out to me is, as Megan just made her statement about including home-based childcare in the conversation to begin with as an important first step. I can't agree more. And I think that one of the silver linings in this pandemic specifically is the fact that there's an increased lens on home-based care now because we took this shift from, you know, a mass usage of childcare centers, and at least here in Philadelphia specifically, when centers were closed, home-based childcare had the option, the opportunity to stay open. And to me, that right there highlights how important this sector of childcare is. But it also creates a concern that I've noticed about including home-based childcare in the conversation and the confusion that sometimes it can create to the larger community and the families that are being served around why is it unsafe for my child to go to a center, but okay for them to attend home-based care. And I think that those are some of the conversations that home-based care could have been included in for that guidance to be a little bit more clear. But again, the silver lining of it is it's now everyone's talking about it and there's a heightened focus on it. And, you know, various systems are speaking to it because a lot of those systems have employees who need that care, you know. None of us can do our jobs that have children without a support system, whether or not it's a nanny, a family, a friend, a neighbor, home care, center-based. We all need that system of childcare in order to be a part of the workforce when we have children. And so for me, I'm trying not to look at the negative, but I'm thinking about this in a positive, is that it's stirring up conversations about the supports that are needed. So even when, and I'm going to speak it into existence, when we overcome this pandemic, you know, we will have more resources available for, you know, the ongoing situation. And if it is to come back again, we'll be more prepared on the opposite end of things. So looking at it through a positive lens.
Great. So I will just for 1 second encourage folks. We'll share some links as we leave, but Own has just put out a paper focused on networks, and we have a section focused on comprehensive services. So would love you to take a look at that paper. We also have a section on our website for feedback. So we'd love to hear from you around how some of these ideas, many of which we shared today during this conversation, resonate. We really appreciate your time, and I'm just going to turn it back to Gina. I don't know if we have time for final thoughts or reflections, but I'll hand it back and say thank you so much for including me in the conversation today.
Likewise, thank you.
Well, thank you both so much for being with us and sharing this really important idea and concept, and how systems and providers and networks can all take that information and bring it back to their homes and their systems. Well, we wanted to invite everyone that, for next slide, please. Next week, we're going to be taking a look at how states have been looking ahead. As we know, they've been working on a better approach to supporting home-based childcare for some time. And we'll take a look. We'll have Rachel Schumacher with us to look at infrastructure for home-based childcare and what states are thinking about in their PDG grants. Well, thank you so much, everyone. The following week, we will be pausing this series for QRIS, and we invite you all to the opening session on July 8th. And with that, we will say goodbye for now. Thank you all so much.
Thank you.